Did you know that when a disease has humans as its only reservoir, it can be eliminated? It is a simple concept. It means that the disease-causing organism or pathogen only lives and multiplies and exists only in humans. It does not naturally exist in animals, soil or water or other parts of the environment. So, if the last infected person is cured, then the disease is gone. No more reservoirs, no more hosts that can reintroduce the disease, so no more diseases. Think about it. The US CDC broadly defines these diseases transmitted only between humans as anthropoonosis. One of these anthropoonosis is mumps. Everyone, welcome back to the channel. This channel is dedicated to explaining biological mechanism. If you are new here, you might consider subscribing and like this if it was informative. Just a quick disclaimer. This video is for educational and informational purposes only, and not as a substitute for medical consultation or advice. Consult a doctor if you are sick. Let's dive into the infectious disease called mumps. Mumps is a contagious viral infection caused by the mumps virus. This belongs to the paramyxovirus family. It primarily affects the salivary glands, especially the parotid glands, which are located near your ears. This is why one of the hallmarks of the disease is swelling in the jaw and cheeks. Mumps is a very common childhood disease, but with the introduction of vaccines, its occurrence has been reduced. However, outbreaks still occur, especially in areas with low vaccination rates. Mumps spread from person to person. Droplets when an infected person coughs, sneezes, or talks. Sharing items, utensils, or touching contaminated surfaces and then touching your mouth or your nose or your face. It is important to know that someone with mumps is usually contagious a few days before and after the swelling appears. People can spread the disease before they even know they are sick. The mumps virus enters the body through the nose or mouth via the respiratory droplets from an infected person. The virus initially multiplies in the epithelial cells in the lining of the upper respiratory tract. It invades the lymph nodes, leading to a mild local immune response. The virus enters the bloodstream in a process called viremia. It travels through the body, reaching multiple organs and tissues. It spreads to the brain and the central nervous system, to the pancreas, to the testes, and to the ovaries. The most common symptoms include swollen, painful salivary glands, usually near the ears, fever, headache, muscle aches, fatigue, loss of appetite, pain while chewing or swallowing. Even when people have mild or no symptoms at all, they can still spread the virus. Although most people's immune system clears this virus after a few weeks, there has been research that this viral infection can lead to some serious complications later in life, such as otitis, painful swelling of the testes. This could rarely cause infertility, but note, it can also cause infertility. Ophoritis, swelling of the ovaries, meningitis, inflammation of the membranes covering the brain and the spinal cord, encephalitis, brain inflammation, and it could also cause hearing loss. However, most of these complications are rare, but they can still occur. This is why prevention is very, very important. The most effective way to prevent mumps is through vaccination. The MMR vaccine is used. It protects against measles, mumps, and rubella. It's typically given in 2 doses. First dose, 12 to 15 months of age. Second dose, 4 to 6 years of age. This vaccination is 88% effective after the second dose. Here is something very important. There is no specific antiviral treatment for mumps. Since mumps is caused by a virus, antibiotics won't work. So what do? Treatment focuses on relieving symptoms and allowing the body to fight off the infection naturally. It helps. So, plenty of rest, drink lots of fluids to stay hydrated, eat soft foods to reduce the chewing discomfort, Use warm or cold compresses on swollen areas. Over-the-counter pain relievers like ibuprofen or paracetamol to help manage pain and fever. Symptoms usually improve within 1 to 2 weeks. Thank you for watching. If you found this video helpful, give it a thumbs up, subscribe for more health content, and spread to share awareness. Stay healthy and see you in the next video.